welcome back to Sahara TV in New York City. My name is Omoyele Shore. As promised, we are bringing you the Nigerian Medical Association officials to discuss this strike in Lagos that has led to the sacking of some 700 doctors. As someone remarked, it isn't a shame that the entire state of Lagos has only 700 doctors. And then, as if that is not bad enough, they've sacked most of them, very experienced, some of them professors, and most of them have been working with the Lagos state government for the longest time over debate and discussions on salary. So we are lucky today to have Dr. Osahon Enabulele, who is the president of the Nigerian Medical Association of Nigeria. You're welcome to Sahara TV, Dr. Enabulele.
Thank you very much.
So let's just put it directly to our viewers. What went wrong? How did the Lagos state government wake up one day and think that they can sack and replace 700 doctors, or about 1,000 of them we had?
Well, certainly it's part of the recklessness, administrative recklessness that does the refining its democratic system, and of course the system of electing our leaders by virtue of popular mandates. And so that things like this still occur in our country is a reflection of the evolutionary trend that we are seeing in our democratic process. So it's in good climes, such things don't happen because, again, before such things are contemplated, you take a lot of factors into consideration. And more so when you are dealing with high-skilled personnel, people who have been trained with other resources of the nation, to develop, to deliver high-skilled quality service to those whose monies have been used to train them. So clearly, it's a manifestation of a kind of decay, really, that does the landscape of Nigeria.
Let me ask you, how many doctors were sacked exactly? Can you tell our viewers?
Clearly, close to about 788 on the record of the state government were asked to leave the service of Lagos state government.
So the Lagos state government have come out with a lot of propaganda saying that, this is about greed and not negotiation, is not about welfare, that they are already, in their own view, overpaying the doctors through conmess, whatever that is called. I mean, what is your view about that?
Certainly, it's like it flies in the face of the reality on ground, because clearly we've seen the documents being bandied around. Certainly, the figures that the Lagos state government is quoting does not translate to reality. Because what clearly the government has done is to take a document that they are publicizing to the public, but in reality is a compressed document that has downgraded the salaries and the career progression of the doctors in the service of Lagos state government. For instance, there is what we call grade level, there is what we call step in terms of the incremental steps in the Nigerian salary structure. The steps could range from 1 to step 11. Now, what Lagos State has done, for instance, is whereas a doctor who is supposed to come in at 15.4, or what we call commerce 5.4 in terms of the unique salary structure of doctors, that doctor is now being asked to start from 15.1, which negates the career professional progression of this individual. And that clearly borders on some level of fraud.
Let me ask you, we heard that the Lagos state government is actually recruiting new doctors. I mean, how is that possible? Where are they getting the doctors from? And how could they possibly replace the same categories of doctors that we've heard? Some of them are professors in the Lagos State University. Some of them are, high-level consultants in the medical field. How is that happening, and where are they getting doctors from?
Certainly, we think they are not being fair in the information they are giving to the public, because we've challenged the government to publish the names of doctors they've recruited, because essentially they are catching in on the ignorance of some of our younger colleagues who perhaps just graduated from university and who obviously, for want of having nothing to do, are being exploited and asked to come and take up jobs that are supposed to be manned by high-skilled professionals. I mean, consultants, professors. I mean, you like I said earlier on, a lot of the guys who are involved in this dismissal saga are people who have been trained for several years, consultants, professors. I mean, you just can't replace them overnight. And so we are not aware of the fact that the people being recruited just now are equivalent to those who have been asked to leave the service. And that is why the organization has challenged them to bring out the figures, all right, to be able to see for real if what they are trumpeting to the public is the fact. And we don't have any doubt whatsoever that there is no capacity, to recruit same amount, same quality of staff set to have been dismissed from the service of Lagos State government.
So the other information we heard yesterday was that the National Association of, I mean, the Nigeria Medical Association on the national level wants to join in a major strike. Is that true?
Well, we have not said we are going on a nationwide strike. What we've tried to do is to see how we can mediate genuine dialogue, because we believe that there was still room for genuine dialogue. But the situation on ground in Lagos State suggests that some persons in government are acting just as conquerors, believing that they have done it and nobody can reverse it, and so shall it be. And that is not the spirit of dialogue. That's not the spirit of negotiation. And so that has made the whole process difficult. That perhaps people are saying that some persons, even though they are true Nigerians, vested with some constitutional rights, cannot even fight for the expression of those rights. And so that has made the whole process difficult. So what the national body has done is to say, well, we thought we could negotiate, we thought we could mediate. Now that we are meeting a brick wall, perhaps we need to recall back our members to let them know of the situation on ground, especially in the light of this extreme propaganda being spread through the hard-earned resources of the people of Lagos State in terms of their taxes to drive a campaign that will not lead them anywhere. And so the strategy on ground now is to get back to members to see how they can key into the new reality on ground vis-a-vis what they thought should be done, as to now be able to define the new reality in terms of the way forward. And that essentially is what is on ground. So nobody has declared any position that will be taken nationally. That position can only be taken by all doctors from Nigeria, and that has to be through what we call an emergency delegates meeting, so that they can also be apprised of the new situation on ground with respect to the Lagos State saga.
So put us back to this condition of the sacked doctors now. We heard that some of them have been ejected from their residences, harassed as we speak. What is the situation? What can you tell us?
Well, sadly, some of the doctors have been forcefully evicted from their residential quarters. And that, again, is something that is worrisome, because we expect that in a state being led by a senior advocate of Nigeria, at least basic adherence to the norms of the state, to the laws of the state, should be kept. For instance, the Lagos State enacted a tenancy exit, and that, of course, provides for a minimum of at least 6 months before you can evict your tenants. And you can't even do that forcefully on your own. But here we have doctors, highly trained professionals, being forcefully evicted after 3 days of being issued sack letters. And so this is one of the most unfortunate developments in the annals of this country called Nigeria.
On a national scale, one of the things that we hear all the time is that Nigerian hospitals have become morgues, mortuaries, a place you go and die, or you don't get, what is the health situation of Nigeria, from the perspective of a doctor? Because even some of the easiest or treatable diseases are transported abroad now. In fact, there's some rumor circulating that the governor has taken his father abroad for medical treatment. What is the situation of our Nigerian hospitals, doctor? What is happening?
Well, in any health system, several components make it up. In terms of the health system is made up of several components, one of which, of course, is the human resource. The health manpower. You have other components, such as the facility bills, and of course, some other extraneous, factors, which go to, of course, define the health system of any community or any country. Now, in Nigeria, we can begin to look at several of these components to be able to situate the reality on ground. Now, when we talk about the human resource in terms of the health manpower or the medical manpower, I don't think Nigeria lags behind in terms of the quality of medical manpower, the health manpower we have in our country. We have people who have dedicated themselves towards service delivery, and indeed delivery at the highest level. But again, even with the best of intentions by these professionals, they need some complementary factors. For instance, the tools to work, the facilities to work. And that is where Nigeria really is lacking largely. But I must say that it is not all a bad situation, because to be fair to previous governments and even current governments, some attempts have been made to upgrade some of these facilities. But the current problem, in fact, what has become a perennial problem in the Nigerian environment, is that even most of these leaders who Nigerians look up to seem not to have that level of faith in the Nigerian situation. And that is troublesome. And that is why you are finding all sorts of public officers, political office holders, even when we have cures and remedies to attend to some of these illnesses, at the slightest, they fly cases abroad. And we have done motivation for this kind of trend. And we found out that beyond just the issue of procuring care, perhaps some of the corruptive tendencies that have plagued that country in terms of the obstacles that follow such trips may also be attributable for this kind of trend that we are noticing. So it may not be all that of procuring care, but again, for those at the political office level, that of the pecuniary dividends of embarking on such trips. So clearly what I'm saying is that Nigeria is not a place where people come to die. The Nigerian health system is certainly not where people come to die. A lot of work is still being delivered, is still being done by the professionals. By the health
I mean, we hear stories about, operating theaters going dark. I mean, electricity going off while operations are taking place. Certain hospitals not having gas to run their generators or diesel. We hear of negligence on the part of doctors, as we've seen with the baby in Lut, and several other problems. What is your organization doing, your association doing to even correct some of these things that has to do with manpower, has to do with the doctors themselves?
But at the level of association, what we can do is to drive advocacy, and that is what we've been doing over the years. Even beyond that, we've tried to, of course, help in extirpating charlatanism in terms of quackery in the health sector. We also tried to establish performance criteria and benchmark in terms of regular assessments or situational analysis of the hospitals in Nigeria. And the best we can do is to offer advice to governments. We are not in the position to implement these ideas. It is government that implements whatever proposals are sent to them at the executive and legislative level. So we recognize that there are challenges. We have identified the challenges, and in every system, these challenges are bound, even abroad. I mean, there are cases abroad that are even worse than what we have in the Nigerian environment. I'm not defending the Nigerian environment. What I'm saying is that the challenge we recognize, the options, the solutions we have tried to drive. And that is why we always, at every point in time, even as doctors, even as professionals, always strive to also make a contribution towards the election or the enthronement of good governance, and of course, true leadership in the Nigerian system. Because unless and until we are in a position to implement, or the best we can do is to offer suggestions, hoping that those we have elected will translate these suggestions to practical reality by way of implementing them and making these services, quality services, available to Nigerians.
Let me ask a very quick political question. The NMA and the NBA, that's the Nigerian Bar Association, used to be very, very politically active. In fact, under the military, the NMA is known as one of the most radical organizations fighting for democracy, pro-democracy organizations during the days of Beko and subsequently Adeniran and the others. It sounds as if, or it appears as if, the NMA has gone underground these days. We rarely hear about it. In fact, if not for the Lagos doctors' strike, I didn't know that the NMA still exists as a labor, as a pro-labor organization. What happened to the NMA, and what is the NMA doing to come back to the consciousness of the Nigerian people in terms of agitation for political, economic, and human rights?
Well, certainly, I share your feelings, really. But you see, in every organization, there are phases. The NMA is going through its own phase of transformation. We've gone through the best days, we've seen the worst days, and now we are coming back to the best days. the NMA, like most other organizations, suffered infiltration by the military. And substantially, the NMA had a period where we were fractured, essentially fractured, and through external interventions. And so the NMA in the late 90s had a situation where we were almost, in fact, as good as being dead, disunited, fractured and splintered. But again, it took the resolve of Nigerian doctors to say, together we must again begin a movement of, not only advocating for our Nigerian doctors, but having a movement that can also advocate for Nigerians. And so for over 10, 11 years, we've had a phasic transformation from those dark years to a new reality. And I can assure you that the NMA of today is not the NMA that you're talking about that was not clear, that was not prominent, even on issues that have to border on development of the Nigerian system. So we are facing development, and just now in the current executive, we believe that even that platform is going to be raised higher, because not only are we determined to be part of the political process, we're also very determined to give very, very firm expression to the legitimate rights of Nigerians in terms of their health rights, and even in terms of the welfare of our members. So clearly on all development issues, we are determined to make our voice known. We are determined to be part of the vanguard for true leadership, sincere and transparent leadership, and good governance in Nigeria. So yes, we have passed through our darkest days. We are now in a new dawn, in a new reality, and we can only tell Nigerians that the NMA of today is the NMA that they can look up to defend their health rights. And that is why you are having this kind of problem on ground right now, because it is no use working and working and working when you know that things are just not working right. Because otherwise you'll be delivering poor healthcare service to the good people of Nigeria. So rather than continue to deliver poor healthcare services, one way is to exit the system and allow those who are vested with transforming that system through taxpayers' money to do the needful. So our assurance, our guarantee is that before the next 2 years, the NMA will definitely be taken to a higher level, a level Nigerians can appreciate, a level Nigerians can connect with in terms of being there as a conscience of the civil society. That we can guarantee you.
Let me ask a quick question here. How many doctors are there in Nigeria per capita?
Well, it's a bit debatable, but the only reference point we have is from the Medical and Dental Council of Nigeria, because that is the regulatory body of doctors. And at the last count, on the register of the MDCN, in terms of the total cumulative figures for over 50-something years now, close to about 52 years, in terms of the cumulative registration of doctors, it amounts to about 42,575. But clearly, in terms of those who are bound in the country, we're looking at a figure of around 22,000.
So there are only 22,000 doctors in Nigeria catering to 150 million people.
Yeah, that clearly is part of the reality we are facing in the country. Yes, in the register of the council, the Medical and Dental Council, you can find figures such as 42,575. But in reality, because a lot of doctors have exited, some doctors, yes, have kicked the buckets, and of course, some doctors have exited the profession for other professions because of the very, very, melancholic and despondent situation we have in the country. So clearly, the figure we can work with in terms of practical figures, in terms of those on ground doing the job for Nigerians, we will talk about in the neighborhood. We'll talk about the figure in the neighborhood of 22,000.
How many doctors are there in Lagos? Do you know?
In Lagos, employed in Lagos State Service, about 1,100 doctors.
So they have only 1,100 doctors and they've sacked 800 of them?
Certainly.
Wow.
And the population of Lagos, we know, in the region of about
15 million people.
Exactly.
That's what we're told. Listen, doctor, what is the minimum condition that must be met for the Lagos doctors to go back to work? Minimum. Can you tell us?
Well, the minimum condition is first for the government to keep to the terms of agreement with the doctors. They signed an agreement several times. The agreements are in print. The agreements are known to the public. And of course, if there has to be trust, if there has to be a cheek-by-jowl relationship between the doctors and the government, because they belong also to the system, government must be faithful to the agreements that she has signed with the group of doctors under the guise of the medical guild. Secondly, government must withdraw all its punitive measures because we are not in a military dictatorship. We are not in a totalitarian regime. So the sack of doctors must be reversed because that is not in consonance with democratic tenets. The doctors had a right under Section 40 of the 1999 Constitution as amended to associate, to aggregate, to protect and defend their interests. And if that law gives them the right to do that, then there is no basis for you to now begin to sack them en masse because the Constitution guarantees them that right. After all, when Lagos State government first took them to court, the National Industrial Court, they lost the case. The court declared that the doctors had the legitimate right to embark on strike. So why now indulge in this kind of, strong arm tactics? Just because you believe that doctors are complacent, just because you believe that doctors are very, very gentle people. I mean, Spartan simplicity should not be taken for a ride. So that is the second condition. The third condition is that all their checkup dues, because again, since this problem started for over 12 months now, the checkup dues, the capitation, they have stopped the deduction. And so they do not have access to their funds. They do not have access to their dues. So, but more fundamentally is the issue of the agreement that the Lagos State government had signed severally with them. That they will implement the salary scale in full as agreed, with no compression of steps, with no retrogression of their career paths. And two, that all the doctors that have been sacked and evicted, they must understand that in democracy, the people are very important. That there is no, there's no room to be mechanical. You don't have to be mechanical in the implementation of the laws of the states. There is a human face to governance. And so the government of Lagos State should look at these issues, address them very critically, reverse the sack, and implement all the agreements they've signed. Otherwise, there will be no basis for trust and harmony within the system.
Let me ask you, is any one of you shocked that Fashola, who has always passed himself off as a very, very progressive, democratic, hardworking governor, he has actually become so fascist against doctors in the state? I mean, he did the same thing to Lagos State University students, where he increased arbitrarily school fees and used the military might to implement it. He did it to residents in Lekki, where they increased toll gate fees and use the military to quash any form of opposition. And now he's after you guys, doctors of all people. Are you guys surprised? Did you feel like he's taking you guys for a ride for too long before you found out that he's probably a wolf in sheepskin?
Well, certainly, when you have a critical dialectical analysis of the Nigerian governance system, no one will be surprised when you see acts like this emerging. Because like I said, Nigeria has not yet gotten it right in terms of how we throw up our leaders in leadership position. And so unless and until we're able to get a system where truly the votes of the people, truly the expectations of the people count, you begin to have acts like this. Because in modern climes, people who have issues in terms of even their mentality, in terms of even their mental background, their medical background, their physical background, and of course even their social background, before they ever get into office, all those issues are screened so that you have fit and proper persons thrown into government. So clearly, the people of Nigeria, and more so the doctors, can never be taken by surprise, because the Nigerian electoral system is still extremely, extremely deformed. It's still extremely, in spite of all the trumpeted gains over the last elections, there are still a lot of issues contending with the electoral system in Nigeria. And so it's clearly one that still needs to be engaged in terms of the real reformation of the electoral system. So whereas, yes, to the ordinary man on the street, one would have expected that for a man who had been so, applauded for some of what was said to be the development strides of the government in the first 4 years, that perhaps, and of course realizing that again, here is a governor who is a senior advocate of Nigeria, that some of these tendencies honestly ought to have been put nipped in the bud or non-existent. But here we are, the same, virus that is plaguing leaders in Africa seems to be plaguing, of course, our leaders in Nigeria. And we only hope and pray that we can get to a point where Nigerians can demand and, of course, have their demands, given true expression.
Well, Dr. Enabulele, we want to thank you very much for coming on Sahara TV, and we hope that you keep us updated as these negotiations are going on, or dialogue, or any more further action taken against your members, or the ones that your members are taking to ensure that they stand their ground if they do so. And so we hope also you come back on Sahara TV again to discuss more about the Nigerian health situation. Thank you very much for sparing some time to speak with us today.
Thank you very much. I must commend the Sahara reporters. You guys are doing great. We are proud of you. We will do whatever we can to continue to partner with you to ensure that not only do we have the truth projected to our people, but of course we can drive some level of synergy towards empowering our people and of course ensuring that there's good governance and development in the Nigerian system.
Well, like somebody said, and before I leave, you are not just a doctor, you're an orator and a poet. Thank you for coming. All right, viewers, it's been Dr. Osahon Enabulele, who is the chairman of the Nigerian Medical Association, talking about the Lagos medical strike. So when we come back, we take you to our next programs lined up for today that will keep you engaged until the end of today's show. It's SaharaTV again from New York City, and my name is Omoyele Shore. Do not go away.